Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government, and we are here today for our bi-weekly update on the COVID-19 pandemic and other issues that are of interest to our community. And today we have Maria Fdoh with the Florida Department of Health Brevard office with us. We have John Scott, our Interim Emergency Management Director, Matt Wallace, our Public Safety Director, Mark Schulmeyer, who is the Chief of Brevard County Fire Rescue, and also Jesse Ray, who is our Social Media Specialist, who at the end of our program today will be giving us some questions that we receive while we're giving our updates. We have a lot of ground to cover today, so I'm going to turn it over to Maria Fdoh for an update on COVID-19. Maria?
Hi, good morning, everyone. This is Maria Fdoh, the Health Officer at Florida Department of Health in Brevard County. Current statistics as of today, we're up to 1,167 cases. We added 70 cases today. Our labs are currently in our county, about 50% of the labs that are reporting out are the rapid antigens versus the PCRs. Overall, it's about a 20%. Deaths, we have 400 deaths in our county. 234 of those are related to long-term care facilities. Our hospitals continue to be doing well, are stable, have capacity. Currently in all of our hospitals, we have 72 cases. To look at our overall 2-week trends of COVID, our state, the labs that have reported out, there's only been 2 days that are less than 5% positivity. And one of those that was less than 5% positivity was 4.95. The median age of our cases over 2 weeks is 35 to 50. Our labs have ranged from 3.31 to 14.97. And our overall 2-week positivity rate is 9.2%. Overall, our positivity rate since the very beginning when we started testing has jumped up to a 10.13%. So we have increased our positive cases in our county. We seem to be somewhat stabilized at a higher level than we had been. So overall, it's very important. Thank you to everyone in Brevard County that's following the masks. We should continue to be wearing masks when we cannot social distance. That's very important. Staying home if you're sick. Sick can be simple as a headache. We've had cases that their symptoms have been a headache. So even a headache that's out of the ordinary for you, you should be staying home. Practicing hand hygiene and social distancing. Wanted to mention a little bit about Thanksgiving, which is coming up here in a couple of weeks. Many of us practice Thanksgiving with large groups with our family members, and it is important to be cautious and determine what level of risk that you're willing to take for your family, with the idea, most importantly, to protect your vulnerable family members and your elderly family members. There's nothing wrong with wearing masks when you're all together. If you can eat outside, that's the best to eat outside. If you can eat with just your immediate family members, that's a great idea. When preparing food, try to minimize the people that are in the kitchen preparing food, rather than having everybody helping out, just to have a few people helping out. But use common sense. There are guidelines that were put out by CDC, and I believe Jesse's going to post that on the Facebook page, so everybody can take a look at that. They do mention even like Zoom meals where family members can eat separately and Zoom each other in. But the most important thing is do what makes sense. Wear masks, social distance, eat outside if you can. And definitely protect the vulnerable population of your family. The other thing to mention is I did last time is flu shots. It's very important for everybody to attempt to get a flu shot, not attempt to get a flu shot, but to get a flu shot. 6 months or older, it's highly recommended. Flu shots are readily available. If you do not have insurance and you want to get a flu shot, they are available at our 3 health department clinics. You may come in and get a flu shot free of charge. And we are having special flu clinics on Friday afternoons in the month of November, not the Friday after Thanksgiving, but the other Fridays. So that's all I have, Don. Thank you.
All right, thank you, Maria. So we also try to practice and follow CDC recommendations while we do these reports on a biweekly basis. And so you'll notice that we wear masks when we're talking, and we also, it might not be easy to tell on Facebook Live, but we social distance here on our panel as well. And we're so social distance today, I overlooked the fact that we have Nikki Hensley with Brevard Public Schools here today, and she'll also be providing an update as part of our program. But for now, we'll move over to John Scott for an update from Emergency Management.
Good morning. As Don said, my name is John Scott. I am the Interim Director for Emergency Management. I'm going to talk about a couple of things today, as we've been pretty busy, both this last week or so at the EOC, and then we'll maintain our level of busyness going through the weekend. So as everyone knows, we're just wrapping up our experience with Tropical Storm Eta. We first had our sort of first round of experiences with Eta earlier this week, last weekend, going through, and then we're just sort of getting on the backside of it today. I'm excited and happy to report that we didn't see significant impacts from that. We were very fortunate, especially when you consider the idea that it was 2 separate rounds of impacts. It's a great reminder that hurricane season does run till November 30th. So we want to make sure that we continue to stay vigilant all the way through the season. We talk about what we can expect going forward the rest of hurricane season. The tropics are still fairly active. We have Theta out in the far eastern Atlantic, and we know we're watching at least one more area in the southern Caribbean for development. I want to take this time to thank everyone who prepared for Eta. That's a big part of our overall strategy to build that culture of preparedness here in Brevard. Again, we want to make sure that preparedness and that level of focus continues through the rest of the season, which does end at the end of this month. And then as a reminder, if you were around in 2005, we actually did have storms in December and really sort of January of 2006. So just because season ends doesn't mean we're 100% done, but climatology does favor us at the end of this month. So maintain your vigilance, continue to be prepared, and watch the tropics. The other thing I want to talk about is sort of what will be a busy weekend for us when it comes to rockets and space. We have an Atlas launch scheduled for tomorrow night. The launch window is 5:15 or 5:13 to 7:11 p.m. That's the Atlas, and then the big launch will be this Saturday. That's the crew launch. That's NASA's first real crew launch. If you remember earlier in May, they did their test crew launch with just 2 astronauts. This will be a full crew list between Falcon and SpaceX and NASA. That launch is right now scheduled for Saturday, 5:44 to 5:54 p.m. I'm sorry, wrong times. That is 7:54 or 7:45 to 7:54 p.m. So it'll be a night launch. It's a weekend launch. Conditions look good right now. They are still on track with the launch. For those who were around for either the crew demo or back in the space shuttle days, you'll remember that crew launches are popular launches. So we expect a lot of visitors in, especially on a weekend for a night launch. So what that means for us locally is a lot of traffic concerns at the EOC. We will activate earlier than we normally do, and we'll bring in more people than we normally do, really to help us manage the traffic situation and make sure we're coordinating it across not just partners locally, but also Orlando, where we see a lot of traffic come through, and then from the north as we get visitors in. It's also a great reminder that if you're going to do errands on Saturday or Sunday, make sure you do them early. Try not to be on the roads, especially in the center or north part of the county. That's really where traffic increases. We know visitors come in early. So traffic we expect to pick up about midday on Saturday and then get really heavy right before launch time. So if you've got errands to run, get those out of the way, get somewhere where you can be, and just sit back and enjoy what we hope will be a really pretty launch. And then the last thing I want to cover, just sort of to build on what Maria said when it comes to Thanksgiving, we've gotten a lot of questions at the EOC about, how do I do Thanksgiving? It seems to sort of be people want to, like, it's either I can't do Thanksgiving or I'm going to do my regular Thanksgiving and I'm just not going to take COVID precautions. And what you heard Maria outline is there are some very easy, simple steps you can do to have a safe Thanksgiving and still gather with your family members close to what you might normally do. Masks are great. One of the things Maria touched on was the idea of limiting who's serving the food. That makes a big deal because that's contact to everyone. When you can, if you can eat outside, great. If you can't, then space out. That's a big thing. But a lot of it is about managing your risk and low-risk activities and high-risk activities. And we're about 2 weeks out from Thanksgiving today, and if you know you're going to have grandparents or someone who's going to come to your house and they're medically vulnerable, now would be a good time to begin to sort of just limit your activities in the lead up to Thanksgiving to low-risk activities. That would be very, very helpful as you go in. So you already know going in, you're doing everything you can to limit the risk and exposure inside your house. And then the last item I will say on Thanksgiving is we also have a lot of testing, so it doesn't hurt to get tested right before you go. The health department is doing testing in Vieira. We know we have the state-run site in Palm Bay that continues to be open 7 days a week. We have partnerships with Parish and Health First and the north end of the county and in Merritt Island, and lots of doctors' offices and urgent care centers are offering testing. So, good peace of mind. Get tested before you do your Thanksgiving. That way you really feel safe going into things. So, again, lots of easy, achievable options to really ensure you have a safe and enjoyable holiday. So, that's what I got, Don.
All right, thank you, John. So earlier this year, in response to the COVID-19 pandemic, the U.S. Treasury Department distributed money across the United States to counties so they could help their communities respond financially to some of the impact of COVID-19. We've done that in a variety of ways in Brevard County. One of the ways that I'm going to talk about real briefly is that we have acquired personal protection equipment such as face masks, gowns, gloves, sanitizers that we've been distributing to small businesses throughout the community, retailers, restaurants, and we have another distribution that's coming up next week on Tuesday, Wednesday, and Thursday, and we do this in different areas of the county, so we have a north, central, and south distribution planned. It'll be November 17th at Port St. John Library in Cocoa, on Wednesday, November 18th at Satellite Beach Library in Satellite Beach, and on Thursday at Palm Bay Library. All these events are from 11 a.m. to 2 p.m. You just need to bring evidence or a business card or a document that displays the name of your business, and then you will be eligible to receive 2 kits, and those kits include 200 procedure masks, 25 reusable cloth masks, boxes of gloves, bottles of hand sanitizers, and if you've already received PPE from the county, you are still eligible to receive more. So again, that's next Tuesday, Wednesday, and Thursday, and all you have to do is show up with your credentials. And for more information on what we're doing with CARES Act money, I will turn it over to Matt Wallace, our Public Safety Director. Matt?
Thank you, Don. And good morning, Brevard County. Thank you for, again, tuning in with us as we give these important information updates as our county fights the pandemic and in particular COVID. Today is November 12th, and I'm going to say that a couple times in my remarks. And I'll start off November 12th. We are one day after Veterans Day, so I'd be remiss if I didn't at least acknowledge the fine work and the sacrifices that our veterans, especially those in Brevard County, have made in their lives to give us a free society and probably and for no doubt the greatest country this world has ever seen. And I'll also say, as a 25-year active duty military person myself, the support that Brevard County gives our veterans is like no other I've seen in the world. I was assigned to 12 different duty locations throughout the world, and the support that they give here, that y'all give in Brevard County, is best by far by none. Your support for military and our veterans who are in uniform and those who wore the uniform in the past. November 12th is also very important because the CARES dollars that Don had talked about earlier, They expire on December 31st, meaning that we have to have those obligated and to the folks that need those dollars. So these programs that we have that we're trying to infuse money into the community to help you out with food, with assistance in your home, with assistances in your businesses, these dollars are going to be coming to an end here in about 6 more weeks. So if you need help, again, please reach out to us at brevardfl.gov/cares. I think I got that right, Don. For all the programs, it's coming up right here on the screen. That's it. Brevard Cares. Go to that website, please, that you see on your screen. And if you're having problems with food, you're having problems with your small business, or if you're having problems with just individual assistance, go on that website and look at the awesome programs that your county is putting forth to make sure that we help you out. So just give a quick update on where we are with several of our programs. First, the Small Business Nonprofit Economic Relief Grant Program. We have now affected over 1,600 small businesses throughout the county. They have applied, and we've put about $9.5 million of real dollars back into the community to help those small businesses. From an individual assistance point of view and statistics, we've helped over 1,500 people with an average amount of assistance at $3,900. You can do the math at home. My Alabama education won't let me do public math, so I'm not even going to try. But we have, again, helped over 1,500 individuals in the county, and more to come over the next 6 weeks if you need that help. From our food programs, the weekend feeding program, we've distributed about 49,000 meals. And from our independent living systems programs, we've distributed over 300,000 meals. From our farmers market, we've serviced over 21,000 households have been served through our farmers market. So again, we're reaching out, we're doing the best we can, and we continue to do that through the end of December. But again, if we can't help you unless you help yourself and come to us and let us know that we can help you. So go to that website and let us know. Again, November 12th is today. My most awesome and favorite emergency management director, John Scott, gave me a brief earlier that says we're sneaking up on 250 days of our Emergency Operations Center being active. And he says that's shattering all kinds of records. So we've been fighting this for quite some time, coming up on 250 days. The fight's not over, and I'm not saying we're on the home stretch or any stretch on the men, but we are still continue to fight. Stay relevant, stay vigilant, and stay informed as we continue to fight this. And again, I just appreciate your time of clocking in. And Don, when we get to the end, we'll talk about when our next one of these will be, because I think we got Thanksgiving holidays coming up, but we'll be sure to inform you when our next information session will be.
Sure.
So Don, appreciate it. And
All right. Thank you, Matt. And we know we throw a lot of information at you in a short amount of time, but if you are in need of any assistance, whether it's paying your mortgage or your rent or getting utilities or food or small business assistance, you can also dial 211 Brevard, and that's simply dialing 211 on your phone, and they can get you to the services that you need. We'll now turn it over to Nikki Hensley with the Brevard Public Schools to give us an update on their end. Thank you, Nikki.
Thank you, Don. Nikki Hensley, Senior Communications Officer for Brevard Public Schools. I will give you the dashboard numbers for COVID-19 cases in our schools as of Tuesday. The next dashboard will be out tomorrow. As of Tuesday, we had 11 new cases in our schools. If you saw the recent Florida Today article, we are nearing about 600 cases total. That is employees and students since the start of the school year. The low numbers, the Tuesday report reports on Friday to Monday numbers. So between the weekend and then Friday, our schools were closed because of the storm. Those numbers were reporting low. So the public can probably assume that the numbers will go up in the Friday dashboard. Don't want to panic anybody. It's just because of how the timing was for them. So I wanted to give you a heads up on that. Let me see, what else can I tell you? As of Tuesday, there were 53 total quarantines, in addition to quarantines from the past. Of those, how they break out, school quarantines, which are contacts to cases within the schools, was 20, and then 33 outside the schools, so either in residence or in the community. The new dashboard will be up. We will post it on our social media page tomorrow, and it will also be up, and our archival data is up for our COVID-19 resource page that can be accessed through brevardschools.org/COVID-19. In other news, we wanted to, on behalf of the district, just thank the taxpayers of Brevard County for voting to extend the half-cent sales surtax for another 6 years to help with renewals and repairs of our over 84 schools and additional facilities. It will go a long way in helping us to continue that momentum that we've built. We, as a district, will continue to report and be transparent through our independent oversight committee reports, but also in our communications of how work is getting done and when it's getting done at schools. But you can find all that information on our district webpage as well if you want to see a schedule of the work that is slated to be done in our schools over the 6-year period, what type of work, look up your school, that type of thing. But outstanding of that, we appreciate the opportunity, and we'll turn it back over. Thank you.
All right. Thank you, Nikki. Our Brevard County Fire Rescue is leading the frontline response to COVID-19, and I will turn it over to Mark Schillmeyer, Chief of Brevard County Fire Rescue.
Hey, thanks, Don. So since COVID has hit Brevard County, we have seen an increase in cardiac arrest cases countywide. And although we can't draw a line or correlate the two, we do know that there is quite an uptick in cardiac arrest cases. What we do know in cases of cardiac arrest, though, is that high-quality, high-performance CPR is critical in resuscitating patients suffering from cardiac arrest. So realizing this, we purchased Lucas CPR devices for all of our frontline ambulances countywide using those CARES dollars that you talked about earlier. The purchase does many things for us. First off and foremost, it provides high-quality CPR for long periods of time. It reduces crew members' exposure to potential COVID patients and reduces fatigue for our crew members who perform CPR for long periods of time. It also frees up personnel to perform other life-saving tasks during those cardiac events. We are extremely excited about this particular acquisition and look forward to getting them on the streets and saving lives soon. And that's all I have for you.
All right, thank you, Chief. So we're going to take some questions that we've received on Facebook Live during this presentation, and Jesse Ray, who is the social media specialist for Brevard County government, has been monitoring those questions. Jesse, fire away.
So before I get started, I just want to plead one more time that we remember that there are human beings on the other side of these screens. So as you guys are writing your comments and having arguments, just remember we're all human, and there's really no need to argue. I see your questions. We're going to ask your questions. So, not to worry. Troll's going to troll, and we'll move on. So, Maria, I've got a couple of questions for you. One person asked, do you think this is the second wave that we had been hearing about earlier on in the COVID pandemic?
Oh, I don't know. I truly don't know. I can't say our cases have ever decreased enough to actually affirmatively say that this is our second wave. Our cases were very high in July, dipped a little bit, and we are inching back up to almost where we were in July, but I don't know if that is a second wave or if it's just a continuation of what we've been having.
Okay. So some states have recently reinstituted some stringent measures for combating the spread of COVID-19. And in light of the trends in cases locally and in Florida increasing, what should the state or county be doing along those lines other than asking people to voluntarily wear face masks, social distance, and wash their hands?
What I can say is Governor DeSantis we are still continuing in phase 3 throughout the state, including Brevard County. And it is very important that we follow the basic measures that have been talked about all along. And that's wearing the mask, social distancing, staying home when you're sick, washing your hands. And I want to reiterate, as we talk about masks aren't the only answer. It's masks along with the social distancing, along with the hand hygiene, and along with staying home sick. So we need to continue to adhere to all of those recommendations.
Okay. And what do you think of President-elect Biden's planned efforts to push for mandatory mask policies?
What I can say is Brevard County and the state of Florida, we follow the directions of Governor DeSantis and our Surgeon General, Dr. Scott Rivkees. And currently, we've never said masks aren't important. So we need to continue, even though we're in phase 3, we need to continue with the basic tenets that I've already talked about, and that's wearing the mask, social distancing, hand hygiene, and staying home if you're sick. The other big thing is we really need to be cognizant of crowds. You know, when there's a lot of crowds for whatever event or activity it is, attempt to avoid. If you are in a crowd, make sure you're wearing a mask.
Okay, thank you. We've gone over this for a few times, but I think it's been a little while. Can you talk about why we don't track or have a recovered statistic for cases?
Well, recovery is defined many different ways by many different states. Currently, the state of Florida is not tracking the recovery. Primarily, you're considered recovered upon 10 days after the start of symptoms or a positive test. You do not need to have another test to say you're recovered. But if your symptoms are getting better, you no longer have a fever for 24 hours, and it's 10 days from the start of symptoms, you're considered recovered.
Okay, thank you. And what are the current hospitalizations look like? I know we
currently, as of today's Agency for Healthcare Administration report, we have 72 in the hospital.
Okay. We got a question. I asked for clarification. I didn't get any, so I'm going to take a guess at what they were trying to ask. So is FDOH Brevard planning to distribute the flu vaccine? I assume they were referring to the flu vaccine, similar to Seminole County. And I'm not sure how Seminole County is doing it.
I'm not exactly sure how Seminole County is doing it either, but I can say we have plenty of flu vaccines at our health department. We have 3 health departments in Titusville, Vieira, and Melbourne. We do give flu vaccines on a walk-in basis. And as I said, we are doing special flu clinics on Friday afternoons in the month of November, with the exception of the Friday after Thanksgiving. In addition to that, we are doing some outreaches. We've done an outreach with one senior place, and we will be, I don't have the dates right in front of me, but we are doing outreaches. If anyone that deals with the vulnerable population, high disparate population, they can let us know, and we can arrange to do an outreach with them.
Beautiful. That's awesome. Miss Nikki, I have one for you, and I'm sorry to have my back turned to you. Is there any talk of making masks optional for grade school children?
Well, for K-2 right now in BPK, we strongly encourage it, but for the young ones, it's not mandatory. As of right now, our school board just discussed this in the last board meeting, and we are keeping the current for 3 to 12. We're keeping it currently that a mask is required when social distancing cannot be achieved, and on buses, absolutely required on buses. When that'll be taken up again, I think we've just got to watch the numbers, and that's what we've been doing closely in partnership with the Department of Health, and monitoring that as we go along. And I would say just tune into the board meetings and the board workshops if you can, because that is discussed. We know how much this means to our families out there and our community, but we also know that the health and safety of our staff and students has got to remain the first priority.
All right, thank you so much. And Dawn, Larry Joe Walker says you look good even with a mask on. So
okay, great.
There's your boost for the day.
Thank you, Larry Joe Walker.
And lastly, I know that it was brought up when our next update is, and in case you didn't have that in front of you, Dawn, sorry, I'm going to steal the spotlight from you. Our next update is going to be December 4th, so that will be after Thanksgiving.
Okay, I think you stole Matt's thunder there a little
I'm
bit.
sorry. I'm sorry.
Okay, so really the main message we want to leave you with, though, heading into the holidays is, whether you're traveling for Thanksgiving or having company over for Thanksgiving, or you're going to a rocket launch this weekend, just stay safe, not only for yourself, but for those around you. So please follow those CDC recommendations, and we'll see you again the Thursday after Thanksgiving.